It's my pleasure to have with us today Hal Godwin in the series I'm calling Reflections from Pharmacy Leaders Advancing the Profession. Hal Godwin is Professor Emeritus at the University of Kansas School of Pharmacy. For years, he was Director of Pharmacy and Associate Dean for Medical Affairs at Kansas. He's known as an advocate for the pharmacy profession and health system and academia. He is a recipient of the Remington Honor Medal and also the Harvey Whitney Lecture Award from ASHP. He's a past president of APHA and ASHP, and he's also served on the board of directors and president of ACPE, our accrediting board, and he was chair of the BPS, the Board of Pharmacy Specialties. He's an early pioneer for clinical pharmacy services and health systems, and has been extensively involved with residency training. So it's my pleasure to welcome Hal Godwin with us.
Hello.
Okay, okay, very good. We'll start off with the first question I have is, we would like to learn more about your journey to your recognition as a pharmacy leader. And reflecting on your journey, you may want to include key events or persons who influence you in your journey.
Okay, well, it's a pleasure to be here. I would imagine that my journey started like many other people, that they weren't exactly sure what the path was going to be. They may have had a vision to make a difference. We might call that leadership today, but I always had a quest for doing something a little different ever since I was, decided to become a pharmacist. And so when I got to the end of my pharmacy degree at the University of Kansas, I had a decision to make, and I was encouraged by mentors or professors to go on and do this thing called residencies, which is very few at that particular time. And this residency was at Ohio State, and it was connected with a master's degree as well. So it was a 2-year residency way back then. We would call it the HSPAL now residency program, but it was a 2-year MS residency. So I went to Ohio State and found my mentor, which was Cliff Lachelet, and I had a relationship with him for decades, actually, on different programs and so forth. So I really got the bug for health system or hospital pharmacy, and at that time it was truly in its infancy. Things that we accept today, such as unit dose and IV admixtures in clinical practice and all of that, were not at all commonplace at that time. And so it really gave us the opportunity to be different and to make a difference in that particular environment. Pharmacy at the local drugstore was pharmacy at the local drugstore, many independents and not very many chains at that time. So I really got the bug and found my mentor, and was fortunate to be able to stay on with Cliff as an assistant director after I finished my residency. And it turned out everything you look backwards to look forwards. It's something you need to do. My thesis was developing an IV admixture program, and at that time, that was not the standard of practice at all. Nursing literally made all admixtures, in hospitals or health systems. And so that was my thesis. How do we do it? And so that got me involved in creating things like mini bottles and mini bags and all of that, and really revolutionized or changed, I think, the practice for pharmacy. It happened to be a very special topic, but it was one that really got longevity. And so hospital after hospital after hospital started implementing that particular service. And so that was really rewarding and carried me a long way, because even after I finished the program and finished my thesis and all that, we kind of had faculty circuit of 5 or 6 of us that went on the road and conducted programs on how other pharmacists in hospitals could implement that. So it was fun. It was a fun journey. And then one thing begets another. All of a sudden, somebody went on a sabbatical at Ohio State, and my mentor said, "Why don't you go over there and fill in, and teach that course?" So all of a sudden, I taught a course called essentially clinical dispensing class, actually, because I hadn't done anything much clinical. I put in consulting booths and all of that. So I've kind of been at the forefront or the prime of a lot of this development over my career, and it's been really fortunate. But the person that finished the sabbatical come back and said, "I can't teach that course because it's been changed so much." So I ended up, that's how I got involved in academia. And so for my whole career, I've been both a practitioner and an educator as well. And that's really stayed with me. So one thing happened to another. And I remember my mentor, Cliff, again, about pharmacy organizations saying, "Don't just be a member, get involved." And so I did. And they would say, "Well, who wants to be on the publication committee, or who wants to be on this?" And so don't just be a member, be involved. And so I did that, and I raised my hand. And then I guess whether you get what you wish for, not that I had any wish for any of that, I ended up finding myself on boards, and I ended up finding myself as national office president in a lot of cases. And so that really propelled my career a lot. We asked about who are your mentors. I've identified my primary mentor, but I have to say, by being involved and in all those boards along the way, I met so many other leaders, so many other people that were trying to make a difference too. And so that rubs off on you, and it's really synergy, I guess, because hopefully you're contributing, but they're really contributing to ideas and thoughts for you. And so it just kind of never stopped. I just keep on going. My wife tells me that I'm a pharmacy organization junkie. I can't get rid of it. And we just keep paying the dues, and I just join them all. So it's not just join, but it's really get involved.
Right.
So it's been a great career. And that's kind of a snippet of how I got started and where I went and the benefits of being involved with our national profession.
Great. Very good. Thank you very much for that. So the next question I ask is about what do you believe will be your legacy in another 20 years? And I rephrase that question, reflecting on all your involvement and contributions to the profession. What are you most proud of that has helped advance the pharmacy profession?
Oh, that is a really tough question. That is really, really tough. I think it's the totality, really, of being a practitioner, being a mentor now, being an educator, and making a difference, I guess, in everybody. I so enjoy teaching my residents and being a mentor, I think, to them. I go on visiting leader programs for other residents throughout the country, and just try to reflect, on, I think we have to look back to go forward. And that is, history is a good teacher. Not that you have to repeat history, but it really does give you wisdom, I think, that is going to be important in that. So I enjoy people. I enjoy trying to make a difference, but now it's payback time, I guess, because I had many mentors and much involvement. And so now it's time for me to pay that back.
Very good. Thank you very much. So the next question has to do with advice for students in their professional journey. And we hopefully are trying to develop our students as leaders, and not necessarily the big L's. It could be the little L's, leaders to really help advance the profession.
Well, I guess my advice is look at the big picture. Healthcare is complex, and certainly in the COVID situation, it's even more complex now. What our roles are going to be, I think organizations have been trying to create new roles for in perpetuity, I guess, myself included when I got started. But I think there's always a challenge to be there for the patient and to develop new kinds of services. So that's been really rewarding, I think. But for new students, look at the big picture. Look at the opportunities. Don't look at just that it's a workplace. It's really a career. You know, I really make a distinction by saying it's your career. And how do you define career? Well, you have influence in your career. It's up to you. And look at the big picture. Work with others. Don't just join organizations, but get involved and become on a committee, become an officer or whatever you can. That even helps you look at the bigger picture even more because you're with associates and colleagues and so forth. And so that is very, very helpful, you know, in order to do that. And one step at a time, you know, try to make really a difference. And of course, Sarah White's famous little L and big L is so important. And I think that I look back a decade or so ago, people that were going into master's degree and residencies and administration and all of that, primarily wanted to be directors of pharmacy or supervisors or clinical coordinators or all of that. But now we've really got a new wave of the clinician wants to get involved in leadership, and that's the little L. And that is so critical. Big L really cannot be successful, I don't think, without a network of little L's. And it's the little L's that are going to make the difference because, you know, they're there. So I say get involved, be a little L, and from wherever you are, be a big L, little L, whatever, but make a difference.
Very good. Thank you. So my last question, as we're studying history, as we study the decade of the 2020s, one of the key events in that decade that will be an event that we will remember will be the COVID-19 pandemic. And I believe that will be, like other events in our history, will be a turning point for our profession. In other words, it'll be an opportunity for the profession. So how do you see that playing out?
You know, I like your word opportunity because it's not a detriment. Well, it is a detriment, but it is an opportunity, I think, for our future. One of the disappointments, I guess, or dilemmas that I have really seen in our profession has been it's kind of been a dichotomy of practice. And if we really look at community practice, particularly in the chains and so forth, we see one level of practice. The patient sees that level of practice. When we go into a health system, we see an entirely different kind of practice. I mean, there pharmacists do have authority for dosing and authority for almost prescriptive authority and all of the things that we're really practicing to the top of our education or to the top of our license, depending. And I'm not so sure that we're practicing that way in all areas of the profession. But the opportunity, you know, is here because obviously with COVID, there will be a vaccine. Where is that vaccine going to be administered? It's going to have to be administered to be successful in the community environment, as well as hospital and clinics and so forth. And I think that's going to give us tremendous opportunity. And we find now, even though it's been lifted temporarily, but I hope it'll be permanent, that literally the pharmacist can do the COVID test. So I think we're going to have a tremendous transformation of opportunity and practice within our community setting for this crisis to really make a difference in how we practice. I facetiously say that we kind of all are aware many times we have a nurse clinician outside that pharmacy in the community setting, you know, and I'm saying, well, where's the pharmacist with that nurse clinician practicing? And I think we have opportunities to, I like to use the word drug therapy management. I think that's what really is happening in health systems and in hospitals today, they're really an integral part of the team. And I think that opportunity is going to present itself, due to this COVID crisis within the community, that pharmacists will be doing tests, will be doing flu tests, will be giving immunizations, will be managing therapy, will be perhaps really focusing much more on compliance and adherence for that patient, and will be really drug therapy managers. And that will really put us at the top of our profession and or practicing at the top of our license. And then we'll need to raise the bar so that we can be enabled, to continue that. So I'm always rosy, or I'm always optimistic about our profession, because I think it's a great profession. But we need leaders of all type, and we need leaders in this ambulatory care area, because it will be sustained, I think, in the health system. I mean, we're almost irreplaceable now. I mean, we truly, it's a team sport in the health arena. Where's my pharmacist? I mean, I remember enabling a pharmacist to go to the unit and practice clinical pharmacy and go on rounds. Now there are 2 or 3 of them up. I mean, hundreds of them up there, really, in the OR, in the ED, and so forth. So we've really made a lot of gains, but we need to be making gains, I think, in community practice where the public is and where the patients are, and there's a need there too. I foresee probably the electronic medical record. We talk about testing. We talk about that, and so that's going to require so we need the electronic medical record in the community practice as well as at the hospital. So if my opportunity or my prediction or whatever I'm saying here comes to bear, then I think the other thing that's going to happen through this crisis is you're going to see a unity of pharmacy organizations like we've not seen. I think that's really going to be healthy, that we're going to have even more of a common cause, in order to help our patients. So it's, it can take a lot of leaders to get there, but we've got to have vision. And if those leaders have vision, little L's, big L's, and technicians I've not even mentioned, but I think that's a whole nother area for growth and a very satisfying career there. So the ultimate goal, I think, is drug therapy management and practicing, again, to the top of our education. And I think opportunity, many times crisis creates opportunities, and I think that's probably where we're at.
Very good. Very much. I really appreciate your insights. Thank you very much for your time.
Okay, thank you.